Stetson's drinking culture is a major health concern here on campus. I think that there are a lot of benefits that come along with going to a small school like Stetson. One of them being able to walk from class to class and say hello to people and know the people you're in class with, know your professors. But I also think that being in such a small, close community has its consequences when it comes to partying and drinking and drugs.
Or people who drink not really super casually, so they'll drink to get very drunk, and that's kind of scary because drinking, I think, should be more of a social thing. I don't think you should drink to alleviate stress or not remember anything, because that has a lot of consequences, socially and physically and emotionally even. So I think the drinking culture at Stetson is different from bigger schools, but in a lot of ways worse than bigger schools, just because of the way that people conduct themselves in settings where there's alcohol.
I view Stetson's drinking culture as a binge drinking culture. There's really no in-between when it comes to the alcohol consumption. It's either people are staying 100% sober or they're drinking until they're blacking out. And even when talking to people, they're like, yeah, there's not even an option to be in the in-between zone. I'm either gonna go full out or I'm not gonna go at all. And it creates an atmosphere where people don't even want to go out because why would I want to go out if everyone's just gonna get blackout?
In alcohol, they'll have these positive things, that college students really want to experiment and have fun while they're here, but they really don't know most of the education that comes with it as to the consequences of drugs. They don't know that it could be highly addictive. They don't know of the long-lasting effects it could give the person, even if they haven't done it in years. Drug overdose has tripled in the U.S. These past couple of years, and it's been costing the economy billions of dollars on medical care.
Consequences of drug use can be physical, mental, social, emotional, or legal. When a person continues to use the drugs despite all the negative side effects, it's called drug abuse or addiction. Addiction can lead to health problems such as illness, injury, or physical damage to the body. It can even cause death. Drug use can also cause personal problems, for example, problems such as loss of motivation and physical or psychological dependence can lead to difficulties at work or at school.
Fraternity has a designated driver system where every day of the week we have a brother who is assigned to drive other brothers to and from different locations safely so that we don't have any drinking and driving.
So to combat this culture, I think one of the big things that my friends and I kind of utilize is the safety in numbers rule. We're always we kind of go out in groups and we make sure that if someone's in trouble that we're there for her first and foremost, and we're always making sure that each girl is is accounted for and is going to be safe at the end of the night.
So I think something that I do that's different from the culture at Stetson of going out to get really drunk and drinking alone is obviously I will go in groups. Obviously I have my close-knit circle of friends and we go out together all the time. We have each other's backs, stuff like that. And also I try really hard not to go out when I'm super anxious or super stressed, because I know that I'll be drinking for the wrong reasons, which I think some people at Stetson do here, like I said before. And also just kind of limiting myself. I don't go out on Tuesdays or Thursdays. 2 nights a week is really all that I can handle personally. And I know sometimes people will go out repeatedly or will drink repeatedly. I don't even it's not I sit in my room and drink alcohol. So just limiting myself and staying with my friends when I go out to keep myself from making really bad decisions. So.
I tend to leave wherever I am by 1 o'clock latest. I just find that anything past that time is the most time that people make the worst decisions. So I try and be in bed by 1 in the morning before the bars close and before everyone starts going back to the frats and stuff. And it's actually really helped me this semester with my grades and also with making the right choices.
before the night begins, I only buy a certain amount of alcohol, and then once that's gone, I don't allow myself to buy anymore.
Back to alcohol. Another problem here on Stetson is like underage drinking. So I think what Stetson can do to help prevent that is actually go to the local liquor stores around here to make sure that they're IDing people before they purchase alcohol, because I have friends and I know people that go to the liquor stores and they purchase as much alcohol as they want, and they're like only 18 or 19 years old. So if Stetson actually goes to the stores to make sure that they're IDing, it would really help prevent underage drinking.
I think Stetson has a lot of really great resources for their students that they just haven't really broadcasted to the community. As a student leader here on campus, I was taught and trained to educate the freshmen coming in during orientation about these policies in the Code of Community Standards book. Basically, these policies include the medical amnesty policy, which is practically just put in place because Stetson wants to make sure that their students' safety and well-being is their number one concern over maybe underage drinking or the use of drugs. The policy basically says that no student seeking medical treatment for an alcohol or drug-related overdose will be subject to the university's judicial processing for the sole.
I feel like Stetson does a good job about like keeping everyone safe. Since it's such a small community, you know, people actually care about each other here. So that's what I would say. I would say it's normal, but you know, people definitely look out for your best interest when it comes to drinking and stuff like that. And it is public health.
Okay, so I think that the way that Stetson handles alcohol consumption and partying and going out is like obviously very controversial, especially within like the last year. I know my freshman year, there was a whole bunch of changes with how P-Safe handled parties at the frats. And I sort of don't agree with that policy because the frats are on campus and it's safe. You don't have people, you know, downtown where they can get caught by police and can have like legal issues, and you don't have people walking home alone, and you don't have people drunk driving or getting in the car with people who are drunk. I think it's, you know, at least the way that I've kind of been brought up is when you're drinking, be aware of your surroundings and be safe. If you're gonna do it the right way.
So I think one of the biggest things that Stetson can do to combat this, you know, serious drinking and partying culture is to deviate from bringing in, you know, guest speakers that are just going to talk about like how much alcohol is in your drink, or, you know, like how many drinks, you know, will affect you and that sort of thing, because I don't think it's effective for at least our campus. I think we need to take on a more hands-on approach to this problem and work on how we can kind of face this problem head-on, realize that it's an issue, and stop denying the fact that, you know, this isn't a problem, like students aren't drinking, like it's not that big of a deal, because it is, and it's a huge health concern, especially if we, you know, let this get out of control, because, you know, alcohol poisoning and those kinds of sicknesses are extremely, you know, life-threatening, and